Hey guys, Don here. I want to talk now about the application and action portion of this interview with Dean Dorfman. So, Dean has been a friend of mine for years. We originally met at one of the American Academy of Podiatric Practice Management conferences, and I almost got a job with him in Florida, but I didn't want to move to Florida, but I went and visited his practice, and that was probably 15 years ago. And he was doing Shockwave then. Maybe that's when he was first starting. But he shared a lot of great success tips. And I just want to kind of focus in on a few of the main points here of how we specifically can apply them and take action on them. Okay. So, first of all, the idea that we have to use the treatments on ourselves or practice them until we get confident in the results. And I want to give you an experience. So we got an ultrasound in our office, and I wasn't very competent. Takes time to get used to using it, and I wasn't sure. And I was like trying to sell it, and like $100 ultrasound, and I wasn't just doing it enough. And so what I realized is I just started doing it at every single person for free, just to practice it. We had the ultrasound, didn't cost me any money. I got very, very competent, and I started to block my ultrasound days. So basically, I had all my patients come back for the same day on ultrasound. So I was doing 5 or 6 at that one block time, and it really helped my confidence to come up on it. And then after I figured out kind of how to do it, then I felt better about selling it because I know it worked. I showed them, and then I added some other things with the ultrasound where I developed one of my presentations on ultrasounds. I showed like pictures, what it would look like, because no one can ever look at or understand what they're looking at on the black and white screen there. So that's an idea of ultrasound. The same thing with Shockwave. We had EPAT, or the radial, and the focused. And in the beginning, I just didn't really have confidence that it worked. I didn't know it worked. I was so used to doing cortisone injections. So I did it on everyone, and we had a really low fee in the beginning, and we were just doing it gangbusters on everyone and saying, I think it was like $50 just to get the practice. And we started to see our patients getting better more and more and more. And that built my confidence to do it more. One of my qualms is, for example, we have things like amnio. It's like $1,500. And because of the price, I can't lowball and just do amnio on everyone to really believe that it works. Same thing with PRP. So some of those other things that are quite expensive in terms of the product, I have a hard time just doing it gangbusters to build my confidence. Another one that I kind of struggle with, and I'd like to know your thoughts, would be laser toenail fungus. I have this laser. I've done it on a lot of people, but I don't see the amazing results or like significantly better results than I do with Lamisil. And because I'm not doing it a ton, I'm just like, some are good, some are a little bit better, but it's nothing that blows me away. And so when something doesn't blow me away or I get really impressed with it, I have a hard time doing a lot of it. Okay. So let's stop talking about that part. The other aspect he talked about is don't beat up on others. And I like that. When he was using a previous machine, like the spec machine, and then the Storts guy came in and kind of beat up the other ones, we never like that. When anyone beats up on someone else, it doesn't really work. So the application in our office is, if someone comes in and they had a bad experience with another surgeon or another doctor, it's just not worth it to badmouth that person. We have to be professional. Try not to talk about it or talk about something else or talk about the good attributes of that person, things like that. So don't beat up on other things. It's just not the nice thing to do. There's an abundance of patience, and we can always speak of good things. Even if they're speaking of bad things, we try to say the good things. Another topic that I'd like to point out is something called Profit First. Okay, there's a good book that I'm reading, and I'll put a little link underneath here if you're interested in it. It's called Profit First. And that's not what Dean used the actual words. But what he said is that you have to have a return on investment on what you do. And this is something that, I know it sounds obvious, but if you're not making a return on investment, you're going to have to like return the machine. It's an expensive machine if you're not doing it. Same thing with the laser. It's an expensive laser if you're not doing it. So you have to have a return on investment, and you need to determine that and use it enough. So that's something that we sometimes get, all these new technologies or all these new things, and we're not able to measure the return on investment. We kind of just throw everything at the wall and we want to see what sticks. So that's not a very good way to do it. Another thing that he mentioned is focusing on what excites you. If sports medicine excites you like it does Dean, do sports medicine because you're going to do it better. Okay, you have to figure out kind of what you really like and then do a lot of that. In Strategic Coach, we call that the unique ability. So doing what you're uniquely really good at and love doing it, and it's not really hard. That's a focus in life in general. So what do you enjoy in your practice? What do you like doing a lot of? What do your patients rave about? And what makes you feel really good? You have to kind of do those things. I have kind of this weird, you probably hear about it as I talk more about it. One of the things that I really like doing is my patients, they tend to get injured when they're trying to work out. And then and when I ask them, well, why are you working out? And do you like to work out? Oh, no, because most of mine aren't sports med people. Like they're not like triathletes. Mine are just normal people working out. And when I talk to them about that, they say, well, I was trying to lose weight. That's what it goes down to. And for me, there's nothing more enjoyable than a patient coming in like 50, 60 pounds lighter and I can help them. Now, I know I'm not a diet doctor, but it's just something that I can really change their life, both in my diabetics and non-diabetics. And I'm kind of tweaking my system. What's working right now for me is basically I have them read a book called either The Diabetes Code or The Obesity Code. And I'll put links underneath on this one, on The Diabetes Code and The Obesity Code. They're both by Jason Fong. And I used to give like tons of information, and I think I overwhelm my patients. So what I do now is I see how motivated they are. I give them the book. All right, it's like 10 or 12 bucks on Amazon, and I send them a link to it. By the way, I use Amazon influencers account when I send them the link. And so what happens is if they buy anything on Amazon, you get a little, I don't know, it's like a kickback from Amazon. It's not that much, but it's called an influencer account. It says on there that I do get that, so they're aware. I think maybe make $20 a month. It's not much. But I give them, or I have them buy these books. And if they read the book and then come back, then I know that they're interested in some type of weight loss. Then I can either refer them somewhere else to get help. I can guide them along if they want to just talk to me every couple of weeks to come in, or I can encourage them to see a coach or something else like that and to work with these different things of weight loss. So that's been something that's kind of inspiring to me and something that I enjoy. He also talked a little bit about marketing Shockwave. I know some of us, we're just kind of too busy and things like that. But if you have something that is a really good return on investment that you're really passionate about, it makes sense for you to go to the shoe stores, go to different local trainers, athletic clubs, running clubs, and even offer to do for some of them for free. That's the key. What's it going to cost you? You do 3 or 4 sessions and they refer all their patients over, or doing it for another local doctor. That's the key. When you can get them in there, when you can wow them, when it works, or even local doctors. A couple of other examples is if it's a local doctor, we'll give them a free pair of orthotics or greatly discounted orthotics. That's key for marketing, because they're going to be constantly sending you patients over. Okay, so doing it for free or greatly discounted, or showing them the great discount that they're getting. Okay. Next, we're going to talk about how to include treatments and kind of the explanation for plantar fasciitis. I liked a few of the things that Dean said. He talked about using the word like micro tears, and this can be shown very easily on the ultrasound. The foot model, using a foot model. If they've also had previous treatments, a lot of times we'll go right to the Shockwave, and I use my patient presentation on plantar fasciitis for this. So if they've tried the previous ones, we'll go right to the more advanced treatments. If they haven't had any treatments, then we can talk about everything else and tell them what we would do and what's covered and what's not covered. And I think that's key because some of the treatments are covered and patients are used to that now. Some are covered by insurance. They have high deductible plans. This is covered and this isn't covered, and tell them kind of your experience. I've been doing this for so long. I've seen this really effective on a lot of my patients. And if I were going to do it, I would do this. The real simple way that I kind of explain it, if a patient has a 8 or 9 or a 10 pain on plantar fasciitis, I might do a cortisone injection. Okay. Because they're limping around all the time, and Shockwave just doesn't give the great results really quick. That would be someone that's never tried anything. If they want to try something, I may try some other things first, but I still do occasional injections if those really high level pains. If it's a kind of a lower level, I'll go right to the Shockwave after they've tried some of these other treatments prior. And I think, especially when you're explaining about the shot, a lot of patients dislike shots. I didn't realize this until recently. I think we just get so used to doing injections, and it's so easy for us. We don't realize that patients really don't like them. And I learned this when I've been doing this OniFix now. I'll put a little link to OniFix. Basically, this thing you put on top. It's a resin that straightens out the toenail, and it works over time. I'm kind of getting used to it. Sometimes they're falling off. It takes a little finesse and technique to learn how to do it, but it's working, and patients really like it because you don't have to numb up their toe. And the same thing with cortisone. People just don't like cortisone. If you've never had a cortisone injection, which I haven't had, I probably don't know the amount of pain. It hurts. I have some females that say it's like worse than childbirth. And then another thing that he said, which I like, is he said it's cumulative. Okay, it's cumulative. So each one builds on the other. That's a key tip. He also said that you need 4 to 6 treatments. You might need 7 to 8. I think it's a good way to introduce it. You'll need 4 to 6, maybe 7 or 8. Most of us in our practice would do 3 to 4, but you put over the expectations, and you over deliver on them. And then the first 4 are a week apart. That's how we do it as well. Then we do a 6-week break. He does a 2-week break, and then another break after that. If they want less, or if they're kind of price shoppers, or if they're in a lot of pain, I might go to cortisone or some of these other treatments as well. We offer care credit just as a way to help them. And we use a pain scale. And I really like his idea, and this is what I do. I do ultrasound. I might not do that the first visit. What I do is I have them come in, do an x-ray, my whole thing. And then I say, on the follow-up visit, we're going to do an ultrasound. And I've gotten confident enough to do that. In our office, the way we do it is we might bill insurance if they cover it, but most of ours aren't covered by insurance. I guess Medicare does, but some of the other ones don't. And we just charge a flat fee of $100. And I'll show them, compare right foot to the left foot. That's a real key. Take pictures, have them take pictures with their cell phone, just kind of like when they're getting their ultrasound for their baby, they like to take pictures. And also, what I do then is after the treatments, I will do another ultrasound, and I don't charge for that. Maybe I should. I'd like to hear your thoughts on that, but I charge them $100, however many ultrasounds I need to do, and we have that in our office. And I like his point as well, telling patients, we're going to do 4 to 5 treatments. If there's no improvement or you're not getting any better, then we're going to pull the plug. If it's not working, we're not going to drag you along. We have to be honest. So if it's not working, or if their pain level is really high, that's when I'll move to the cortisone, or I'll move to something else, or I'll get an MRI. And so really, you have to have competence in how to do it. You have to have confidence that it's going to work, and you have to be honest and tell them if it's not working. And then another big thing he mentioned when he's explaining it, we can keep people active. We can keep them in their sports. We can keep them doing these things. And then he did end kind of saying a few other things, gives them a shoe list, over-the-counter inserts, night splints, and UFOs. We recommend also UFOs in our office and different shoe recommendations. Once again, we do this via the Amazon influencer account. I will send you a link under here. You can see my influencer account, so you can see kind of what I put on it. It's basically a virtual storefront based on diagnosis for me. And I'll put a little link so you can start your own influencers. It's pretty easy to do that. And then these other links that I talked about, these books, Profit First, Obesity Code, and Diabetes Code. So if you found this beneficial, let me know. I am putting together, we have always these monthly group sessions. Go to Podiatry Practice Mastery to learn more. And also I'm putting together a mastermind group. It's kind of by selection only. And if you go to Podiatry Practice Mastery, you can apply for that to be part of this mastermind. Basically, it's a group of people that are all podiatrists, and we're going to help each other on our own practices together. Okay, great. Have a great day, guys.